Welcome back. The seventh biennial Global Alcohol Policy Conference kicked off at the Cape Town International Convention Centre yesterday. According to reports, worldwide about 3 million deaths every year result from the harmful use of alcohol. The conference, which ends on Friday, seeks to chart a way to reduce alcohol harm in the country and around the world. We're joined by Professor Charles Parry from the South African Medical Research Council for more on this. Professor Parry, thank you so much for speaking to us amid this global event. Could you just perhaps give us some more context around the stats with regard to how alcohol contributes not only to deaths but also to diseases and injuries globally?
Yeah, as you said, it's about 3 to 4 million deaths a year. But we know that if you look at South Africa, and I think we're typical of many countries, in fact, we probably stand out in terms of the link between alcohol use and trauma, and we experienced that particularly during the COVID-19 pandemic, when there were various temporary liquor sales bans and we found the hospitals were empty. So, there's that link, and there's also the link in South Africa between alcohol and infectious diseases like TB and HIV, also mental health problems, and we know that we stand out as one of the highest countries in terms of fetal alcohol spectrum disorders. And we also had interesting presentations today from people around the links between alcohol and cancer. Someone from the IARC, which is the World Health Organization's cancer section, and also a brief presentation at our opening reception from a cardiologist who talked about that link. So there are very many links between drinking and harmful health practices.
Of course, we do know also about the social impact, the negative social impact of alcohol. We struggle immensely with gender-based violence, and there's been a direct link made to alcohol abuse, especially in lower income communities where there's a lack of social support. So can you tell us what the aim is, apart from reducing the harm? What, in practical terms, is this conference hoping to achieve in the South African context?
Yes, thank you. I mean, I think one of the aims is to really bring world experts in this area, and some of whom work directly in the alcohol field, and some work in areas such as alcohol marketing and using AI to test whether industry is breaking marketing guidelines. And so we really want to bring South Africa up to speed in terms of what works, what the evidence-based policies are, and also we really want to get movement on policy reform. We've had several pieces of legislation move part way, and they've all become stalled. And two of them more recently, for example, the 2020 effort to reduce the maximum blood alcohol allowed in drivers with the 2020 Road Traffic Amendment Bill, which in fact later they took out that provision to drop the alcohol level to 2.02 or even 0. And then we've also had sort of a lack of movement around controlling alcohol marketing. In 2013, Cabinet approved the Control of Marketing of Alcoholic Beverages Bill, which would really substantially curtail alcohol advertising, and then that sort of has stalled or in fact been dropped from government's priorities. And perhaps the biggest issue, which actually led to some protests during the minister's speech this morning, was around the inaction around the 2016-2017 Liquor Amendment Bill, which has been stalled by the Minister of Trade, Industry and Competition, and that department. It's gone nowhere. It's a very important piece of legislation which would deal with issues around the availability of alcohol, and also looking at a bit around alcohol advertising, and perhaps address the issue of relooking at the age limit for purchasing and consumption of alcohol. So yeah, there's we want to see action in South Africa around bringing down the problem. We had the Enyobeni Tavern tragedy last year, where 21 young people, underage youth, died after going to a tavern in the Eastern Cape, and the president and everybody rushed down to Gqeberha for the funeral and talk of action, but really nothing has happened since then. And also we learned a lot from the COVID-19 situation. Really, we don't have a new normal following that. We haven't really learned the lessons we should have following that.
It's a very difficult debate for those people who earn their livelihoods and whose families depend on the liquor trade industry, especially those people who do function within the parameters of current laws, who aim in every respect to trade responsibly, because we do have this informal liquor sector as well. And for those families, curtailing the hours during which they may sell, or curtailing their marketing options, or even increasing the age of drinking in South Africa, that would have an impact on their livelihoods. Where do you fit into that debate between the balance between economic growth, where alcohol sales play a part, and doing no harm or doing less harm?
Yeah, I mean, that is something that has to be discussed. I mean, I think it came to the fore recently in Limpopo, where the government in that province decided to curtail liquor sales to midnight because alcohol was being sold to 2 a.m. And then, there was a major pushback from the liquor sector around that issue. But one has to balance, obviously, between addressing harms, and you have substantial savings in lives and economic costs to the provinces when liquor hours are reduced. So yeah, I mean, it can't be part of the themes of the conference is putting people before profits. And I remember during the COVID-19 situation, a person involved with the Liquor Traders Association said that he was speaking to his constituency around maybe the need to diversify and move out of only selling one product. I mean, if you was, I think from a business point of view, it doesn't make sense to only have one line item, because if something happens, you're going to experience problems. And I think we need to look at liquor traders looking to diversify into other areas as well.
The other part of that argument is that if you curtail the legal sale of alcohol or the legal marketing of alcohol, the illicit trade simply takes up that space, because we are a nation that is used to overconsumption of alcohol. Do the stats support that argument?
Well, we can go down that line, and I think we're seeing the industry depends on people over drinking, and that was discussed as well, where if everybody drank moderately, in fact, we would see a massive drop in the liquor sales in this country. In fact, one piece of research showed that we'd only have 32% of the alcohol being sold if everybody drank at responsible levels. So we do have a massive problem. And around the illicit trade, that was also mentioned this morning in a plenary session we had on alcohol pricing, and we had a presentation from a colleague who'd worked in Kenya, where they'd had a very successful initiative to deal with illicit trade, which involved tracking and tracing of illicit products, where you actually have a way to a scan on liquor containers, and you can only sell them if they are part of the legal system. But obviously it requires enforcement. And then I think the people involved in the legal trade would do better if we dealt with the illicit trade. And I think we have to deal with that. There are strategies that have been shown around the world that can be effective in dealing with the illicit trade. So that's part of the solution.
So you use the word enforcement. That is absolutely critical. It doesn't help we change regulations, tighten policies, if we're not going to have the kind of resources in place to support those policies to make sure they're correctly implemented and enforced. I'm sure that is also on the agenda at this conference. Unfortunately, that is where we're going to have to leave it, but we do appreciate your time and your insights into this very current topic for South Africans. Professor Charles Parry from the South African Medical Research Council, talking to us there as the 7th Biennial Global Alcohol Policy Conference kicked off in Cape Town yesterday.